Hey guys, this is Tanya, your favorite new nurse coach. If this is your very first time seeing my video, I am Tanya. I've been a nurse for about 18 years. I am a family nurse practitioner and also an educator working in the higher education for nurses. So I'm here to help you build your confidence and your skills, especially if this is your first year in nursing. So we are going through our first 365 days as a nurse. Today we are on day 31. You have just come off orientation. So I want to prepare you for what it's going to look like when you come off orientation. A lot of you may be excited. You're like, thank God, I don't have anybody looking over my chart. I don't have anyone like pressuring me to get things done within a certain time, right? You may be really excited to come off orientation. And some of you may be very apprehensive. You may be very fearful and feel very anxious about coming off orientation and working by yourself. So one of the things that you're really going to need to do is set up your time management. You really need to hone in on the things that you need to do in order to make your shift go as smoothly as possible. So one of the things I recommend for you to do is to get there early. So if you're working 7 a.m. to 7 p.m., get there latest 6:30. If you are working night shift, again, get there about 6:30 p.m. so you could take a look at the assignment, so you could know who you're getting report from. That is very helpful, because if I know I'm getting report from a nurse who's like a type A personality, I'm going to operate differently than someone who is not a type A, or someone who doesn't necessarily keep their room stocked, or someone who doesn't really leave the patient looking like nice and pretty, right? If I'm getting report from a certain nurse who I know really is a slacker, I'm gonna have to make sure that the room is stocked, to make sure I have enough TEN in the room, to make sure that if the patient is on a certain antibiotic, that there's an additional one in the fridge, that there's medications there for the patient, right? Whereas if I'm working with a type A patient, I know that getting report from them is cool, but maybe giving them report the next shift, the next day, I have to get my stuff together, because this is a type A person and they're going to want kind of like perfectionism, right? So you get there at 6:30, you figure out the minutia of what may be included in your day. Also, it really gets you a chance to look over your patient's history. So the first time that you are getting introduced to the patient is not on report, right? You kind of had a chance to look over their history. You got a chance to look over their admission note if they're coming in from the emergency room, or if you work in a long-term care setting and they just got admitted, you can kind of look over their paperwork. Secondly, you can look over labs. And then also you can look over their MAR and see the anticipated medications for that shift. And then, as I said before, to the best of your ability, ensure that the medication is there for your med pass. So looking in the patient drawer or looking in the refrigerator to make sure they have that particular antibiotic. You may need to call pharmacy in order to get those medications stocked if it's not there. So I highly recommend getting there on time. Getting your time management down also includes having a checklist. So by now you kind of know the sequence of how things operate on the floor that you're working on, right? You know that you may have to do your own vital signs. You may have to do your own finger sticks. You may have to do your own AM care, whatever that includes, right? So I would recommend for you to go ahead and do a checklist so that you can make sure that you are getting things done in an appropriate time fashion, but also that you're not doubling back, right? Because sometimes when we're really inundated with a lot of work, I'm just like, did I do this? Did I do that? Did I document their eyes and nose? Did I do a note on this particular patient? So it really helps you to streamline the process of checking things off and ensuring that nothing is missed. And then also the last thing is to just trust the process. So if you have been on orientation for whatever the allotted time is, some of my LPN clients, they only get orientation for 4 weeks, which is crazy. Some of my RNs working in the hospital get their orientation for 12 weeks, right? So if you are coming off orientation, there are nurse educators there, there's your nurse manager there that know that it's the appropriate time for you to come off, right? And so I encourage you to trust the process. It's going to be very bumpy. You are going to be clocking out later than when your shift ends, because you're getting used to it. It's the first couple of months off orientation, and it's really, really going to be like a healing process. It's going to reveal a lot of things that you may not be comfortable with. It's going to reveal a lot of insecurities, and just be ready for that. So these are the things I'd encourage you to do coming off orientation. If you want some one-on-one coaching, I am opening some sessions for the remainder of February. So go ahead and click the link in my bio. And again, stick tuned to the next video, which I will share with you tomorrow. Like and follow for more.